Module overview. This module is designed to provide comprehensive training in the specialized techniques of capillary blood collection and pediatric phlebotomy. You will master both the theory and application of microsampling methods in neonates, infants, children, and adults where venous access is limited. The module aligns with international clinical standards and child rights-centered practices, ensuring trainees can deliver safe, accurate, empathetic care. 7.1 Fundamentals of capillary blood collection. Capillary blood is a mixture of arterial blood, venous blood, interstitial and intracellular fluid. It is commonly used when only small amounts of blood are required. Venous access is difficult. Minimally invasive methods are needed, e.g. infants, elderly. Key advantages: minimally invasive, less pain and trauma. Quick recovery, no venous collapse risk. Ideal for point-of-care testing, e.g. glucometers. 7.2 Indications for capillary collection. Capillary sampling is preferred when venipuncture is contraindicated, e.g. burn patients, hemophiliacs. Only microvolume samples are required, e.g. neonatal bilirubin, glucose, hematocrit. Pediatric patients or geriatric patients with fragile veins are involved. Frequent sampling is needed. POCT devices are used. 7.3 Selection of capillary sites for infants under 12 months. Heel, medial or lateral plantar surface. Avoid posterior curvature, risk of bone damage. Use a pre-warmed heel for improved blood flow. For children and adults, fingertips, middle or ring finger, lateral side only. Avoid index finger, high nerve density, and thumb, pulse present. Avoid pinky, too small and near bone. Sites to avoid: swollen or cyanotic areas, previously punctured sites, infected and inflamed areas. Fingers of newborns under 6 months, risk of osteomyelitis. 7.4 Equipment and supplies. Single-use lancets, depth 1.5 mm to 2.4 mm. Capillary tubes or microtainers with proper additives, microcollection devices, bulb pipettes, capillary tubes. Antiseptic, alcohol or chlorhexidine, cotton or gauze pad bandages for children over 2 years. Gloves and PPE heel warmers, optional but effective. 7.5 Procedure for capillary blood collection. Patient identification. Use 2 identifiers. Obtain parental consent for minors. Explain procedure in age-appropriate language. Site, preparation, warm site to increase blood flow. Clean with alcohol and air dry. Do not touch cleaned site again. Performing the puncture. Use a sterile lancet perpendicular to fingerprint ridges. Wipe away the first drop. May contain interstitial fluid. Collect using appropriate containers. Filling by capillary action. Post-puncture care. Apply pressure with gauze. Do not use adhesive bandages on infants. Comfort and reassure the patient. Labeling and documentation label immediately in the patient's presence. Record time, initials, and any difficulties encountered. 7.0 Special considerations in pediatric phlebotomy techniques for children. Involve parents to caregivers when possible. Distract using toys, videos, or storytelling. Use EMLA cream or cold spray if protocol allows. Swaddling infants may reduce movement and anxiety. Do not use excessive force. Restrain aggressively. Attempt repeated failed punctures without escalation. Promise it won't hurt. Be honest and comforting. 7.7 Common complications and preventions. Complication, cause, prevention, hemolysis, squeezing site too hard, allow free blood flow, contamination, poor site prep, proper cleansing and technique, inadequate sample, cold site or improper depth, warm area, use appropriate lancet, osteomyelitis, deep puncture in newborn's heel bone, use proper site, medial lateral only, hematoma, excessive milking or pressure, gentle handling, firm pressure, post-procedure. 7.8 International standards and guidelines. To meet accreditation standards, practices must align with Clinical and Laboratory Standards Institute, CLSI GP42, World Health Organization, WHO, Best Practices for Phlebotomy, Centers for Disease Control and Prevention, CDC, OSHA, Needle Stick Prevention Protocols, Joint Commission, Pediatric Care Guidelines, ISO 15189, Medical Laboratories, Requirements for Quality and Competence. All procedures should integrate infection control, biohazard waste disposal, accurate patient data management, and empathy-centered care. Learning outcomes for Module 7. By the end of this module, you will be able to identify proper capillary sampling sites across patient demographics, execute safe and effective microsampling techniques, demonstrate pediatric communication and calming skills, prevent complications specific to infant and child blood collection, follow all labeling, documentation, and infection control protocols, align with international healthcare and accreditation benchmarks.